So it's exciting to be here today and to have a report to give. When this comes to a safe emergency department, whether it is our supportive recovery housing, we've talked about the need for a drop-in center and enhancements to the addiction supports that we have in the province. In all of these things, it is our goal to remove the gaps that previously led so many people to return to an addiction. So currently, when there's an individual who seeks support and comes into detox or recovery programs, they're often placed back into high-risk situations and they struggle to achieve stability over the longer term. Individuals completing addictions treatment need access to certain things. And one thing they need access to stable housing and a safe place to be, a safe place to live, to put them back on a path to a healthy lifestyle. Residents in supportive recovery housing settings stay between 6 and 18 months, and they do more than just live there. They get help there. They receive ongoing support in their recovery from community agencies who know this work, who know how to help them obtain employment, attend school, to learn how to volunteer, to develop new skills, to fill gaps and address gaps that need addressing as they continue on. And I would say that for us as a society to pretend that people can do this on their own is unreasonable. And that's what the results show, that if left to their own devices, people feel overwhelmed trying to look down that path ahead. But others can help them, others can mentor, others can encourage, others can support, and others can gently correct. And that will help people move along their way, committing to live a sober lifestyle, committing to fulfill a post-treatment plan. So currently in Manitoba, there are only 7 organizations that provide supportive long-term programs here, approximately 174 people annually. But demand has gone up, and almost 1,000 people now are seeking post-treatment supportive recovery placements. And so supportive recovery housing plays a key role in the recovery of substance use and addiction. It provides that stable environment, as I've said. The organization offering the housing often provides ongoing, or it does also provide ongoing support for tenants to fulfill their post-treatment plan. It reduces the likelihood of relapse, and the evidence shows that supportive housing is an effective option for those who are in need of alcohol and drug-free housing accommodations. And that is why we announced a request for proposals last fall for the development of supportive recovery housing units. And today, I'm very pleased to be able to announce that our government will be investing more than $2.1 million for the development of 70 supportive recovery housing units in Winnipeg. The province will provide financing for one-time capital costs and operating funding. Asylum Mission will develop 20 such units. Winnipeg Supportive Housing, Inc., in partnership with Rivwerwood Community Church, will develop 40 units at Rivwerwood House in Elmwood, and Tamarack Recovery, Inc. will develop 10 units. These organizations are chosen based on submissions that they issued last fall, which focus on expanding system capacity for rehabilitative supports in both urban and rural areas and address the increasing demands for services. The $2.1 million investment will allow these organizations to develop program-based housing solutions, providing on-site support services, and the goal of this is to be operational by March 31st of next year. And I know it's a tight timeline, especially in a COVID-19 environment, but we are confident that these timelines can be met. As I said, recommendations from the Virgo and Illicit Drug Task Force both identify the need to add supportive recovery housing units to help meet this demand for services. And this new investment will go a long way in meeting that demand. We're pleased to work with these community partners. We're pleased to help support them as they, as the real experts on the front line, build these programs, offer these services. And I want to personally just add my thanks to these organizations, to their leadership, to their staff, to their boards. I can't imagine the hard work that goes into responding to such an invitation. I know there's been tremendous work done behind the scenes. I know there's tremendous energy in this room and optimism not only for the funding, but really in terms of what it will mean in the lives of the people that this funding will go to serve. Together, we are working to ensure that our services are there to meet the needs of Manitoba and of Manitobans. Today's announcement, I would finally say, builds on the over $31.6 million that we have already invested since last October to improve the health of Manitobans and to improve access to mental health and addictions treatment, including the $3.5 million that we announced last week for the Bruce Oak Recovery Centre, an investment as well to expand Project 11 in Manitoba, and a pilot project to provide mental health and addiction services to families at risk of child apprehension. Thank you, everyone. Great to be here. I can't wait to hear from the other speakers. Thank you.